Welcome to my YouTube channel, Retirement After Heart Transplant. If this is your first time stopping in, my name is Alan, and we'll be talking about heart transplantation and living with that afterwards, particularly in retirement. Um, I put a couple of videos up. I was going to first get out of the way my heart health history and how I got to heart transplant. So my last video, I talked about that. And went up to my first heart attack, which was in 1992. So I want to kind of go to the next steps here for a couple minutes. I went back to work, I think I said in the earlier video, and felt fine, did well. Was taking meds, for protection of my heart. Specifically, I was taking something called Coumadin, or warfarin is the generic name. People call it a blood thinner. It's an anticoagulant. Kind of a bear to take that. You have to go to the doctor every 3-4 weeks, maybe a little longer if you're lucky, to have your blood levels checked to see how that Coumadin is working in your system. Because if your blood gets too thin, so to speak, that's really not the right term, but they're going to change your dose. And so I did that for quite a few years, specifically about 8 years until I had my next heart event. Carried nitroglycerin around everywhere I went. Nitroglycerin is a little small pill that in this form, if you have chest pains, you put it under your tongue, and what it does essentially is it goes into your body very quickly, and it expands your blood vessels and can relieve chest pain. Fortunately, I never once had to use it for that purpose in all those 8 years. Not once. At any rate, living normally after that heart attack, working, playing, doing all the things we normally do. In 2000, 8 years after that first heart attack, my wife and I were out on a walk one day, and I began to feel some chest pains. And this was, again, the first time I felt chest pain in 8 years. And right away, we knew we got to go get this checked out. So I went to the regional medical center that had taken care of me the first time in 1992. They immediately rolled me into a heart catheterization room and did the heart cath, looked around, found immediately I had a severely enlarged heart and several blockages. And all of this was essentially the result of the fact that I had significant heart damage in 92 the first time. Heart's working really hard to keep me going, and it's like kind of like a muscle. If you really work it hard, it's going to expand, it's going to grow. And so that was going on with my heart. They immediately rolled me from the catheterization lab into a heart surgery room. I had what sometimes they call a CABG, CABG, coronary artery bypass graft surgery. I had 8 bypasses. Bypasses are where they take blood vessels from another part of your body or even arteries, and they stitch it into your heart and go around the blockage so that you're bypassing the blockage and your heart's getting blood, your heart muscle's getting blood to it again. Again, if you are you got a heart history, you know about these things, but not everybody listening knows these things. Had 8 bypasses, which was apparently some kind of a record at that particular hospital. After a couple days, was sent home. And by the way, just to talk about the bypasses a little bit, in my case, they got some of the blood vessels for the bypasses out of my thigh, my right thigh, which is pretty typical. Back then, when this happened, this was rather new. They also got vessels out of my forearms, both of them, radials they're called. These are arteries, not blood vessels. Arteries are supposed to hold up better, when used for bypass surgery. Lo and behold, I get home, and within the first week, I'm sleeping one night, and I was sleeping in a lazy boy. I couldn't lay down. I was too uncomfortable from the surgeries that I'd had. I don't know, maybe 4 or 5 nights in, I woke up in the middle of the night. I knew something was wrong. I felt really, weird, really strange in my head. I realized immediately I couldn't use the left side of my body. I think I knew pretty much what had happened. I had a stroke. And what happened is those four arteries that four bypasses that they use the arteries for, collapsed. And when they collapsed, the blood just kind of stopped going to my brain very, very rapidly. And that caused what is called a watershed stroke. So the type of stroke I had was a watershed stroke. I guess they're marginally better than a plain ischemic stroke, which is just a blocked blood vessel in your brain. Marginally better, not much. Just, again, I lost the left side of my body. I could not swallow. It was pretty rough. It was very, very frightening. Very, very frightening. At any rate, when my wife got up and called our neighbor who lived right across the street, who happened to be a nurse in our inn. He came over and took one look, and he knew what was going on too. I had a stroke, and first thing he says is, "You got to get to the hospital quick." The thing about a stroke is if you have one, it's really important that you get treatment quickly to prevent permanent damage or to lessen the possibility of permanent damage. So I don't know exactly how long it took me. Maybe the hospital was 45 minutes away. The ambulance had to get there. In any case, they got me to the hospital. Went to the same hospital that had been, treating me and where I just had bypass surgery. Saw a neurologist and a couple other doctors, and they determined what had happened to me. And it was a very scary, scary time. I was, hospitalized for several weeks. Fortunately, I did get back the use of the left side of my body, pretty much 100%. I think altogether it took probably 4 to 5 weeks for me to get to the point where I could go back home. And even at that point, I still wasn't all there. Still felt really strange. My brain was still adjusting and accommodating for the damage that it had suffered. And it took several more weeks for me to really feel totally normal. But I got the use of my body back before I left the hospital after that 4 or 5 weeks. I never will forget, I think I mentioned in my introductory video that I'm a musician. I play drums, guitar, a couple of other instruments. One of the things that really hastened my full recovery after I got home was actually sitting down behind a set of drums. When you have a stroke, your brain has to reroute circuitry to help you to do things that you used to do. It's an interesting process. I won't go into all that today, but I remember still, not feeling quite normal, little not dizzy, but just different. And we were in church one weekend, and I played drums in that church. I had not started back doing that, obviously. But either before or after the service, I went up and I sat down behind the drum kit, picked up a set of drumsticks, and felt very strange. But I just kind of did a few things, starting to beat on the drum, and immediately I began to feel something reconnecting. That's the only way I can describe it to you. A doctor could give you the physical reasons behind that. I guess my brain was reconnecting those circuits. And so anyway, that just helped me get some fine motor skills back really quickly. And from then on, it was kind of downhill. It was got much better really quickly. After 3 or 4 months, I guess I went back to work. And, again, everything was fine. Felt good. Was able to do pretty much anything I wanted to do. Could exercise, could kayak, could walk, whatever. Cut the grass. So I was really blessed in that regard. That was good. Anyway, so that takes me up to that point, and I hate to keep breaking this up in such small pieces to get you to my heart transplant, so we can talk about other things. But I don't want to keep these. I want these videos to be short, and, so I'm going to stop at that point. And in my next video, I'll talk about how I got to transplant and kind of where I am with that. Then I hope to just sort of branch out and just begin to talk about other general things. not just talk about me, but talk about things that are going on around here. Hopefully, some of you will have some questions or comments that I can reply to. Um, at any rate, I do thank you for listening, and I hope you'll come back and listen again. So if you got anything out of this video, if you got any good information or enjoyed it, I would appreciate it if you would hit the like button and if you'd subscribe to my channel. Thanks, and we'll see you next time.